Hello, Colin Hung here for Healthcare IT Today, and I am in Nashville, Tennessee for the NCQA Health Innovation Summit. The NCQA team invited us down to cover their event. The organization gave us a free media registration, but we have paid for everything else. This video is not paid for by NCQA. I'm excited to sit down with my next guest. Ed is the Chief Technology Officer at NCQA. I have a wide array of questions I want to ask him about interoperability, TEFCA, and data quality. Let's get to it.
So my name is Ed Yurcisin. I am the Chief Technology Officer at NCQA. NCQA, we define healthcare quality for the country. We have measures that are utilized by a majority of the population in one way or the other that help really position value-based care. So the country is moving from fee-for-service to value-based care. The challenge is, what is value? Well, value is a function of both cost and quality, and we help define quality, enabling value-based care. And this is really, the effort is really trying to improve the healthcare environment so you are getting better care at lower costs.
I want to go there because I think it would be a fair statement to say that many people want to get to a more value-based care system. I think it totally makes sense conceptually, intellectually, but we're moving very slowly. I mean, most of the system still remains fee-for-service, despite some of the more recent, work in the ACO space and in the value-based care space. What do you say in response to that when people are kind of like, well, hey, maybe this experiment is done. We didn't really get.
No, it's starting to work, and we're trying to reduce burden and frictions to drive it forward. Yes, CMS has pushed out its timeline several times. Now they'd like to see digital measures fully implemented by, I believe, 2030. And we're doing everything we can to facilitate that. So we have taken our HEDIS measures, which are about 80 measures. Volume 2 is what we call it. And that was an 1,100-page PDF and somewhat inefficient for the country because we have, over 100 organizations reading Volume 2 and interpreting it. And when you read English, there are a variety of interpretations. It was a little bit gray. So we have now created digital quality measures. We have digitized the HEDIS, the Volume 2, in a language called CQL, Clinical Quality Language. This is a language that CMS is encouraging and pushing. And think of it as really a logic that you can put on top of FHIR data. And FHIR is the Fast Healthcare Interoperability Resource Standard that the government's been mandating and requiring out of from both payers and providers and EHRs. So FHIR data is FHIR is a scary term. It's really high school level computer science. So last year, my son took AP Java in high school, and he learned about something called JSON and REST APIs. That's what FHIR is, coupled with a data model, but everybody needs a data model, and we're trying to have one unified data model and value sets. And then the last piece is it's the interoperability data exchange standard that the government is mandating. So that's why FHIR is important. But healthcare is notorious for taking simple concepts and giving them scary names. So this is just high school computer science. It's not anything. Everybody listening to this is probably using REST APIs and JSON today. If you go to any website on your computer or your mobile phone, your smartphone, you'll be using REST APIs and JSON. So nothing scary. Very standard. And that's what makes it, I believe the adoption will continue because it is an industry standard. This is how ESPN communicates scores, like the LA Dodgers won last night. This is how they communicate the scores and the content to the website.
So, in your opinion, then, if it's not the technology, you said it's high school level stuff that we're doing, we've obviously got an incentive at a conceptual level. So, what sort of other things could we be doing to accelerate this? And I know NCQA is at the forefront of this. So, how are you pushing us as an industry really forward?
Well, the next thing is, so we've reduced burden into making digital measures. The next challenge, and this kind of goes hand in hand, is you do quality measurement, then you need data quality. So we are one of the use cases for data quality. And you're seeing ASTP, formerly known as ONC, really leveraging our use case for data quality. Think of us as the snowplow clearing the streets. And if data is good enough to be used for HEDIS quality measurement, then it's good enough to be used, it's at least a starting point to be used for public health and for prior authorization. But if it can't be used for HEDIS, you're not going to be able to use it for public health or prior auth or any of the other CMS mandates or desires. And the challenge with data quality is it's all contextual. So data quality, as referenced, as needed for what? What's the use case? And we are the use case. And because HEDIS quality measures are used by the government for Medicare Advantage reimbursement, as part of that process, we're fairly closely tied to money. The public health use cases, while critical, they're further away from the dollars. So I would think you're gonna see less advancement from public health. And that's why the CDC is working with us, or we're working with the CDC, trying to leverage what we're doing. So again, if the data is going to be good enough, clean enough, and usable enough for digital HEDIS measures, then the CDC should feel confident in using it for public health.
I like that. I mean, NCQA is just one of these organizations that sits at this sort of nexus point between government and the rest of the industry, payers, providers, everybody. In that context, what are some of the things that maybe you're bringing from industry to the government to say, hey, listen, if you just make this a little bit easier, we could get there a lot faster?
We're helping drive and inform the CMS digital roadmap. We're trying to inform ASTP on some of the challenges that we're faced with. So ASTP, Nikki Tripathi has a program called a 10 by 10. He's trying to get 10 payers and 10 providers exchanging bulk FHIR or population level FHIR data. And prior to the 10 by 10, we actually started the Bulk FHIR Quality Coalition. And we have our first cohort where we have Cambia, eHealth Exchange, and Multicare working together, exchanging data. This is extending the work that ONC had started with Boston Children's Hospital through an ONC LEAP Award. So Ken Mandel and his group at Boston Children's did a great job testing what's called the G10 endpoint. This is the regulated endpoint out of EHRs to do bulk FHIR. All the EHRs are required to do this. And Ken was able to test, think of it as the water pressure, but he didn't have a context to say, is the water drinkable or is it sewage? He concluded that the data coming through the pipe was low pressure. And that's an ONC or ASTP now is pushing the EHR vendors to make their bulk FHIR capabilities more performant. Well, is it sending clean data or is it garbage or sewage? And we're evaluating that now. The Bulk FHIR Quality Coalition it's a good thing to do to drive the country forward and to inform ASTP on is it working or not? And is it of high quality or not? If it's not of high quality, we're relying on the government to actually impose some, move the EHR vendors to improve the quality of that. But we can highlight it. So that's one of the ways that we work with ASTP right now.
We are sitting here on stage at the NCQA Innovation Summit here in lovely Nashville, Tennessee. So I want to ask you, what are you hoping that the attendees at this particular conference will walk away? What's the key message that you think you want them to take?
I'm the CTO, so I've been involved in really the digital transformation. That digital quality measures are here. They can be utilized to improve care, to close care gaps, and really get patients or beneficiaries the services that they need in a proactive fashion. And that's good for everybody. It lowers the costs. When you're getting your the proper preventive care, you're going to be in better health. And there will be fewer true tragic events because you're catching things earlier. We have a unique position of a very important role at NCQA in the country's healthcare ecosystem of helping to say something about quality of the care that you're receiving, that health plans are providing or encouraging. And it's a very unique role where we fit between the government, between payers, between providers, and we're a nonprofit, so we're part of this is really to help everyone be better.
I love it. Well, you've given us so much great information. Where can people go to learn more about NCQA?
NCQA.org, and you will find information about our bulk FHIR quality coalition, about our digital HEDIS measures, and I would start there.
Excellent. Ed, well, thank you so much for being on the program. It's been great to have you.
Thank you.
I want to thank Ed for coming on camera and educating me on all of those topics. It was clear to me that he has a very precise vision of where things need to go, both from a technology and a policy standpoint. And hey, if you enjoyed this interview, please mash that like button and click subscribe. Also, head on over to healthcareittoday.com where you will find more great content like this. I'm Colin Hung for Healthcare IT Today here in Nashville, Tennessee at the NCQA Health Innovation Summit. Thanks for being here, and I'll catch you on the next episode.